This is a neuropsychological disorder. That means it's a medical thing. We need, the more we as general public understand about what is dementia, we will be able to help the society. We will be able to help. To give you an overview, what we are going to go through today is to make you understand, to give you insight on what is dementia, what are the warning signs, how to identify, and what are the care pathways. Like when someone gets these warning signs or symptoms of dementia, how to identify and what to do after that. And then for normal people, like what are the preventions, what are the risk factors to understand, like, how we can prevent dementia for ourselves. So, and of course, a little bit about what we are doing right now. We are one novel organization in the state itself who is providing services for dementia. So before starting my slides, Trishant, sorry, there are a lot of people trying to join in. Is there a way you can do it, or I have to admit them?
I'm sorry. Really admitting them, don't worry about it.
Okay, really perfect. Thank you. All right. So, yeah. So this is what we are going to go through today. And here we start. So when we talk about dementia, it's like, okay, there is memory loss. So why are memories so important to us? We are actually our memories. What if we just completely go blank out? What are we going to be left with? If we don't remember what we are, what is my name, who I am, what is my background, what time, or what is the orientation, and where am I from? I lose the individuality. I lose that self. I lose the entire environment I am in. So we are our memories. Our memories makes us, and that is why it is so important to have the memories intact. And to give you an example, this is on the screen. You can see a healthy memory and a failing memory. So if we lose our memories, this is exactly happens, and that was what happens in dementia. So let's see what exactly is dementia. So when we talk about dementia, there are a lot of myths, there are misconceptions. People say that, oh, it is an aging thing. It is part of aging. It is something like, there are a lot of demeaning or tabooness or stigma associated with it, where people will say that, oh, that old man has just gone mad. Or they will have a lot of myths about it. They will say this is destiny. They will say that, okay, this is something like, they are just pretending. There is a lot about dementia that we really need to understand. First thing, to start with ourselves. How? I'm going to talk about that. So what exactly is dementia? As we all know, dementia starts with memory loss. But memory loss is exactly a tip of iceberg. Dementia has a set of symptoms under that memory loss or under that iceberg. So dementia is an umbrella term described for a range of symptoms associated with cognitive impairment, like thinking, judgment, understanding, orientation, language, speech, so many things. They all come under cognitive impairment. And dementia is a disorder which has all this range of symptoms. So as you see on this screen, so there are different types of diseases that causes dementia. Alzheimer's is the very common one, and a very common word also that we know. Other than that, in India, we have a lot of vascular dementia, which is like post-stroke. Then we have Lewy body frontotemporal. Always remember, dementia is very complex disorder because it starts from the brain, and brain is the most complex thing in the body. So what happens? As I said, memory loss, forgetting, and other cognitive issues. It covers a range of physical diseases like Alzheimer's or frontotemporal disease. Then dementia is very progressive in nature. It keeps on increasing and eventually it is terminal. It affects generally older population, but in many cases, or earlier we used to say it's a rare case that somebody under 60 would get dementia. But now, unfortunately, in the last 1 month, I have seen like 3 to 4 cases who are in their 30s, 40s, and 50s. So it is not anymore where we say that, oh, it is only a aging. Yes, predominantly it is, but there are a lot of young onset dementias that we are seeing nowadays. There was a study done it was a survey done in Hyderabad from Nizam's Institute, which said that there are about like 50,000 plus people living with dementia in Hyderabad alone. So why have we not heard of them? What is the reason that even though the number is so high? So to bring it to your point, this survey was done in 2013, and by now this number has doubled. So of course, it's something around a lakh. Difficult to say what the exact number is. But my question to everyone is, being in a memory clinic, being in a dementia center, why are we not seeing these 50,000 people? Okay, forget it. Let's say 50% of it. 25,000 people? No, not even that. There is a very less number that actually comes to the services. Why? Because there is so much of stigma attached to it. Another thing that I want to highlight about dementia is there is something called reversible causes also. So before we get into the depth of what is dementia and the irreversible causes of it, we need to keep this in mind. There are a lot of conditions which will show dementia-like symptoms. It could be due to psychiatric disorders. It could be because of depression or certain viral infection, or certain medicines will have memory loss and cognitive impairments. Brain tumor can lead to memory loss or some metabolic disorders. And in a lot of cases, vitamin B12 deficiencies. Now, if these symptoms are treated at the right time with medication, they are reversed. So they will show dementia-like symptoms, but these are the set of symptoms that can be reversed. So always keep in mind that not everything is dementia that it looks to us, because maybe after the session, every time there is a memory loss in us or we forget our keys, we will start thinking that, oh, am I getting dementia? That's not the case. So we need to understand very well that how to identify or what exactly starts dementia, right? So as I said, that Alzheimer's is a very common thing, a common disease that so it is overall 70 to 80% of dementia that Alzheimer's people will be there. So Alzheimer's is a disease of brain, and that causes symptoms like memory loss, and that is exactly dementia. So it is not part of normal aging. One thing that we really need to understand that it is noticeable it starts with forgetfulness, but it's severe enough to affect the activity of daily living. Other symptoms include confusion, getting lost, misplacing things, trouble in speaking, language, comprehension, writing, etc. So dementia was something which comprises of 70 to 80%. My mistake. Alzheimer's is something that comprises 70 to 80% of dementia. The other kinds of dementia that we see is vascular dementia, which is led after stroke. So that will have of course, it will have memory loss, but the other things are like there can be paralysis, there can be motor issues, there can be speech issues. So it will have a different set of symptoms additional to dementia, and there are about 20% of these cases that we get to see. It is very common in India. Maybe we get to see these most because there is a lot of very high cardiovascular issues in the society. Then comes frontotemporal. Even though it is only 2% of dementia cases, it is the most tricky, and it is very tricky even to diagnose, and even it can get so complex to manage also. So I think frontotemporal is the, from the complex of dementia, it is the most complex one. Also Lewy body, which is 4% of the cases. Because they are so complex, it gets a little difficult for even for the doctors also to diagnose at the right time. And that is a very common global issue, where because the symptom starts in a very slow and a different manner. It generally starts with the behavioral issues, and that's why a lot of diagnoses are misled. So I just said that there is a difference between normal aging and dementia. So to give you some examples, normal forgetfulness is something that we all go through it. Like we will forget where I have kept keys, where I have kept my certain daily things, or sometimes we also forget to keep say switch off the switches or gas stove or things. But we are able to retrace it. We are able to retrack that, okay, when was the last I came home? Where is the possibility I must have kept the keys? Whereas, for example, for Alzheimer's or dementia, they will completely forget that event altogether, that they have kept the keys. And there's a high possibility that, they will forget the concepts of things. So they may keep keys somewhere like in the most unusual places, like fridge or microwave or even washing machines, because they are forgetting the concepts. So, and they're not able to retrace the step. So like how a normal person would think that, oh, I came home and then I must have kept it there, I generally keep it here. So we are able to rationalize and trace it back as a normal people. Whereas in dementia, because they lose the short-term memory, they lose the concept of things, they will misplace things in very unusual things, where that is a very big warning sign, that where you see maybe footwear in fridge, the concepts are so abnormal, as they are as there is a manifestation of these cognitive impairments. So, for example, like, somebody has traveled from a different city via plane, and there is a high possibility a dementia person would completely forget that event altogether, or even forget that, oh, I am in Hyderabad, or I came from Delhi, or what medium, or what travel mode did I take. So they will completely forget the event, whereas a normal person will forget a part of it, and we are able to trace it back. So I'm sure you can hear the background voice. So welcome to the festivals happening. And so some warning signs that we all should know about dementia is memory loss that affects day-to-day abilities. For example, like a housewife who has cooked all throughout her life, but suddenly she's not even able to make tea, a cup of tea. So, these are the common thing that we do day to day. Someone who has done over the years and suddenly having difficulties to do something like that familiar. Difficulty performing familiar tasks. As I said, making a tea. Problems with language. Some people having name finding difficulties. So they will be like, oh, I went there and I had that. And like, where exactly did you go? And they're not able to recall. So that is the name finding difficulty. That is an example of problem with language, but there's a high possibility somebody will have a complete loss of language ability, where they're not able to understand or comprehend what the other person is saying. Disorientation to time and place, like they're confused that there are so many lights on in the room, so they may get confused that is it night or day. Whereas we are able to have a normal person will have a short-term memory to come quickly understand that, oh, I just had my breakfast, I came here, it must be like 11 o'clock by now. Whereas a dementia person would be like, there's so many lights on, maybe it's late at night, and that's how their brain will start working. So I'm just trying to give you how to judge, how to differentiate between a normal and warning signs. There's an impaired judgment. Impaired judgment could be something as small as like not able to understand that how much salt to put in the food, or the salt is missing from the food, or how hot the cup of tea is, or how to cross the road at the right time. So they will lose their judgment, problem solving with abstract thinking, misplacing things, keep on searching things over and over. There's a mood and behavior changes. In some cases, there is complete personality change. Someone who was a very calm person, or someone who was a very social person, is suddenly becomes very aloof, or suddenly has a very aggressive talk, or is inappropriate social behavior. And loss of initiative, where they don't want to do anything, they're just sitting. So there's a lot of reason why there is a loss of initiative. Maybe they are so confused, or there is no memory, short-term memory, or they have a very good insight that they are forgetting. So they will, gradually withdraw that I know, because they have an insight that I am forgetting something, I'm not doing it right, I'm not able to judge, I'm not able to speak. So gradually they will withdraw from their daily living, and they will ideally sit in a corner and not do anything. So that is loss of initiative. So we need to know these warning signs very well so that we can identify other people. And once we identify, then starts a whole new journey. So what to do when someone has these symptoms that we just spoke about? So first thing, you identify the symptoms. First thing what you have to do is go to a doctor. You have to go to either a neurologist, a psychiatrist, or a physician, someone who understands dementia very well. So first step is consultation with a doctor. The doctor will generally then give advice for cognitive assessments, which are paper pen tests, where a psychologist or a neuropsychologist would do paper pen tests to understand the cognitive abilities or the behavioral issues. Based on that report, again, the psychologist or whoever has done this assessment, they will send it back to the doctor. And based on this report, the doctor will again ask for maybe some blood tests or scans, MRI scan, CT scan, based on whatever the doctor feels that is needed to understand what, eventually a diagnosis of dementia will be given by the doctor. Then what happens? Then there is the treatment of for the person with dementia. When we talk about treatment, one thing is sadly that there is no cure for dementia. There are no medicines that are going to cure. But there are medicines that will slow down the progression of dementia. There are medicines that are very symptomatic. So for behavioral issues or certain issues, or for sleep, or any other issues related to dementia, the doctor will prescribe medicines, and those medicines are something that are must to be taken. So on the slide, you can see like it's divided into three. One is the medical treatment that your doctor prescribes. The other one is non-pharma intervention, which is basically therapies, and that is something must as equal to the medicines. So it is like your the therapy that we are talking. So the therapy could be cognitive stimulation therapy, meaningful activities, or there are a lot of therapies. I'll talk a little later about that. Then there is, for the person with dementia, there are these interventions like therapies. And the other thing is like daycare, residential care. So these are the things that all comes under the care for dementia. The last column that you see is for the caregiver. So once the diagnosis is given to the person, it is the start of a journey. Not only for the person with dementia, it is the start of a journey for the family altogether. So what happens? So the same chart, I have put it over here. Now, the last column that we are talking about is for the family caregiver. the one who provides constant care for this person with dementia, because they need that kind of a care. It is not just that they are just losing the memory, they are losing their function, freedom, independence. So there is a need of a person, a carer, to 24/7 look after this person with dementia. So, who is a caregiver? Generally, in our culture in India, it is the family who provides care. It could be a spouse, it could be a child, or it could be the in-laws, say daughter-in-law, or it could be some relative who is providing this care. So, one person in the family will automatically fall into the category of primary caregiver. So, what happens to this caregiver? They have to provide the care 24 hours. And the other term that is used generally in developed countries is unpaid care, because they are doing a full-time job and nobody is actually paying them. Paying doesn't mean always in money, but it is an unpaid care that they are providing for another person. Keeping in mind that this caregiver is a family person, has their own family, has their own job, has a lot of other responsibilities, maybe towards children, maybe towards their own spouse. So it is like completely taking care of another person. So a caregiver has to go through a training of dementia so that they understand what are the symptoms, what is going to happen to the person, what are the different stages. In every stage, there are different set of symptoms, how to manage, what are the services that are available. So it is a complete additional burden to the person who is taking care or providing care. They themselves need a lot of support and counseling because they are overwhelmed with this kind of work. And then it's like they have to manage their self and the person with dementia and burden. When we talk about burden, it is not only just the physical burden, it is a lot of emotional burden and, of course, a lot of financial burden. Dementia is a very expensive disease because in our culture or in our society, it is everything out of pocket expenditure for the dementia care, and it happens at home.